Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Bobby in here with us today. And Bobby comes down here all the way from Chicago just to see me. This is really his last ditch effort before he has spine surgery. Is that correct?
Correct.
And I've gone through about 30 pages of medical records and diagnostics here. He has had 3 ESI injections, epidural steroid injections, about 12 to 13 trigger point injections, 3 sacroiliac injections on each side, chiropractic care, 13 months of physical therapy, and you said that didn't help at all.
No.
And you've been dealing with this for how many years now, Bobby?
It's three solid years.
3 solid years, but he played a lot of sports when he was younger, from wrestling to football to martial arts, so he's taken a lot of hits in his body over the time, and he's had hip replacement surgery, which we've looked at all that. He's got herniated disc in his lumbar spine, bulging disc, facet arthrosis, but he does not have central spinal canal stenosis, which is a good thing. He does have a lot of facet arthrosis and degenerative disc disease in his spine from just years of wear and tear. And is there anything I left out?
The shoulders.
Oh yeah, his
triceps.
shoulders. He had shoulder surgery. He had both knees operated on.
Had a bunch.
And right hip replacement. And he gets headaches frequently. He's had how many kidney stones?
I've had one in the right, 2 in the left, and there's still
Got the one in the
10
left.
millimeter in the left.
10 millimeter stone in the left, which I checked him on that today. He does have some pain in his lower thoracic spine region, but he also has a vertebral subluxation complex there, which I'm going to adjust today on the Gonstead knee chest table. And I don't think he's ever had that adjustment before, have you?
No.
The only thing he's had done, I think, is the ArthroStem mechanical instrument adjusting, correct?
Yes.
Okay. All right. So he's down here for last chance, so I'm going to give him everything we've got over the next 4 days. Let's have you close your eyes and bend your head forward and backwards for me, please, Bobby. And then back to neutral. Okay, see, he's got a lot of forward head posture. His ears are dropping all the way out here in front of his clavicle. It's about 2 inches forward of his shoulders. That's why his shoulders are rounding forward. You can see how his hands are all out in front of him here as opposed to being at his sides. He's got no space over here on the right-hand side, but he does have some space over here on the left-hand side, so his pelvis has translated to the right on the x-axis, while his head's forward to the left on the x-axis. Now, we did some orthopedic neurological tests on him. I'm just going to show you a few of the positive ones. Go ahead and sit right here. Okay, this is called a compression test, and that hurts, you said, down in your lower thoracics right there, right?
There and on the back left neck, yeah.
In the left side of your neck right here. So this is a maximum foramina compression test. That hurts right there in the lower cervicals,
yeah.
right?
Yep.
Okay, and then when we go back and left, same thing?
Yep.
On the same area?
That's correct.
Did it hurt down here at all?
No.
Okay, so those are positive maximum foramina compression tests. I did a shoulder depressor test on him this way, and it definitely stretches out in his traps there in the bare scapula. He says this actually feels better.
Mm-hmm.
And then when we go this way, that tightens up on the right trap as well, and that feels better to him as well.
Mm-hmm.
This is a distraction test where I'm lifting straight up on his occiput. Did that feel better, same, or worse?
Better.
Better. So we're going to check his strength here. I'm going to push down, resist. Good. Same thing here, resist. Good. See, he's got 5x5 strength there. I did his biceps and triceps. They were good. Push. Good. And he had normal reflexes on those as well. I'm not going to do all those over. But we're down to his adjustment now, so let's go ahead and lay on your tummy. I did more orthopedic neurological tests on him to rule out certain pathologies. We did straight leg raise test on him, Fabry-Patrick test on him. One of the tests I did do that showed up positive, go ahead and lift your right leg up. Okay, now relax that one, do the same on the left. Yep, this left one's harder. So he does have a left sacral deviation test, and he has left SI joint pain upon palpation. Now, if you look at his leg length, he's 3/4 of an inch shorter on the left side than he is the right side. And then when I bring it up, his left leg gets even, so that evens out. That's a positive knockless Deerfield test on the left and a left sacral deviation test. So I'm going to start adjusting him on the BioPhysics table here on his left SI joint and left sacrum. Just breathe and relax. So he's pretty much exhausted all his medical avenues of treatment, with the exception of the last one being spine surgery, which he doesn't really want to do at his age, and I don't blame him. They told me I had to have neck surgery or I'd be quadriplegic, and I never got it done. I got chiropractic care from my good friend, and no surgery for me on my knees or my back or my neck, and they wanted to do surgery on all of them. Surgery, in my opinion, is the last resort because it's very invasive. Even the minimally invasive surgery is invasive. You know, if you have bladder or bowel dysfunction, now his left leg was shorter by 3/4 of an inch, now it's equal. And this should already feel a little easier than that first one did.
Oh, yeah.
Yep. Okay, so I'm not going to adjust that lower thoracic, but I am going to adjust the lumbar spine here. There's L5. There's L4. L3. L2. All the way up to L1. Now I'm going to come above in your mid-thoracic spine. Okay, keep breathing. There you go. That's it. Okay. You're going to feel your head popping up a little bit on this one. Good. Okay, let's turn you on your back now, please, sir. I do my exercises all day. There you go. Just lay your head in my hands here. Yep. And bringing your head back and over your shoulders because yours is way forward. Now put your arms straight out to the sides, palms facing up. Okay. Where'd that hurt? Slide down this way a little bit. That lower thoracic area. Now, I'm not ruling out that he doesn't still have pain in his kidneys from that stone that he has in his left kidney. However, he says his renal doctor tells him that's not where the pain's coming from. Isn't that correct?
That's what he says.
Okay, just relax your right leg in my hand here. There we go. Now, you should have felt that in your knee all the way up in your back. Did you?
Yeah.
Okay. Keep breathing. Hey, we're just getting started here, bud. There we go. Okay. Let's kind of set you up sideways and face that way. There you go. Good. At least you're getting up right. You got a lot of crepitus in this right shoulder. Keep that chin up for me. That's it. Boy, crack addict's gonna love you. Oh boy, a lot of crepitus in this left shoulder too. Yep. Okay. You get your elbows here. Now I am going to decompress him, but first thing I'm going to do is I'm going to take him over here and put him on this Gonstead knee chest table to adjust his lower thoracic spine. Because he does have vertebral subluxation complex in the lower thoracics, and I think that's where he's getting a lot of that pain that you were talking about there. Okay, let's come over here on your knees on this table. Face up in here. Okay, now, just to relax your hands down. Now, once you let your spine kind of just sink in here, it's probably going to be a little sore there at first. I'm getting a knife edge contact right on the spinous at T11, T12.
Oh!
Yep. Hang on. There we go. All right, that's all that's gonna move. That was very tense and tight in there. Okay, so I'm gonna have you lay on your back right here with your butt there. Head up that way, please, sir. There. See, we're in the corner suite, so when people yell and scream like that, the only people that can hear it's out there on the freeway. This is the first time you've ever had the spinal decompression done, right?
Correct.
There you go. Are you sleeping like this yet?
I am.
With your legs elevated?
Not as high, but it's.
Okay, you gotta have them up parallel with the floor to be effective.
Okay.
You can't just put a pillow under your knees. There you go. Now, I want you to keep your teeth together. Breathe through your nose. Oh, there you go. And I don't have to ask if you felt that all the way down. You did, didn't you?
I did.
Yeah. And look at there, you're still kicking. Okay, just relax your head in my hands here. Okay, let me do the work. Don't try to help me. Tilt your head right. There you go. Okay. So I'm going to have you come back over here and lay on your tummy for a second because I'm going to stick my elbow in your lower thoracics to see if I can calm that muscle spasm down.
Alright.
So let's get up sideways and come over here and lay back on your tummy for me. Now this is one of those hurt so good treatments. I'm going to stick my elbow in the paraspinal musculature of his lower thoracic spine. Right here, take a deep breath. Exhale. This is going to hurt. Deep breath. Exhale. And another deep breath. Exhale. So I'm leaning all 230 pounds of my weight into his paraspinal muscles here. You feel that?
Oh, yeah.
That's good, because if you didn't, I'd be sending you off for another MRI. You've had how many MRIs now? 3 or 4?
3 or 4.
Mm-hmm. But he came prepared, and if you're coming from out of state or out of the country, you definitely want to bring all the diagnostic tests that you've had done to me, because if there's something that I need to see and you didn't bring it with you, I'll have to send you out for it here in Houston. Is the left side more sore than the right one? Or are they about the same?
The left.
Left more?
Oh, yeah. Every time you come up is when it.
It hurts worse when I let off, doesn't it?
Right. Yep.
That's why I'm doing letting off slowly. Okay. I'm gonna go all the way down here in the pocket down to L4, L5 too. There we go. Okay. Let me try one more thing here while you're on this table. Okay. Keep breathing. There we go. Okay, let's stand you up over here in front of the mirror now. I knew this wasn't going to be easy on him. Okay, so I'm going to have you close your eyes again for me on this one, Bobby, and flex your head forward and backwards again. You should be used to this from Chicago shots. I'm going to shoot you now. I'm going to pull both shoulders up and back, and this is your homework right here.
Okay.
Bring that head straight, no, let your neck go. Bring it straight back first, see, and then look back at the wall behind you. You'll feel that all the way down that lower thoracic and lumbar region. Adjust your atlas on the x-axis, which sends neurological proprioceptive information into your cerebellum, which is the hindbrain that controls balance, posture, coordination, and kinesthetic movement throughout your body. Now I'm going to stretch your head forward here, and I'm going to bounce the muscle spindles down in your lower thoracic spine. Okay. Now, let's have you flex your head forward and backwards again for me, please, sir. And take a look at neutral now. Much better centered up now. You're standing up straighter than you were when you first walked in. Your head's up and back more than it was. Your ears are dropping here now over your clavicle as opposed to out here in front of your clavicle. Mm-hmm. But you're still forward and your shoulders are rounding. How does your spine overall feel right now compared to when you walked through the door?
It's like I actually feel like I'm stretched, like a little taller.
Mm-hmm, you are.
Yeah.
About a half an inch right now. But has this pain eased off at all, or is it still pretty sore?
It's easing up now.
Okay.
Once we stood up.
Okay.
Yeah.
And then after you get your adjustments, I want you to walk with your arms swinging freely. Okay. That'll help you hold your adjustment better. That's called cross crawl.
Okay.
Now he's going to be here in Houston over the next 4 days, so we're going to see him once a day for the next 4 days and try to help him out with this. We'll try to see if we can keep him from having to get the knife, and we'll keep you updated. We'll do another video on him Wednesday or Thursday. Do you have any comments that you'd like to make to people? Did you get a thorough examination here?
I did.
And history?
Absolutely, yes. Haven't had this ever.
So you're from Chicago. You flew a long ways here to get this.
I did.
Would you tell others that it's worth their while to come here?
I'd recommend it to everybody if you're at your, even if you're not at your last ditch effort.
Yeah, you shouldn't be at your last ditch effort before you decide to see us. Although a lot of people who come here are. I love a challenge, and Bobby's a challenge, and we're going to be working on him all week this week.
Awesome.
Thank you for sharing your story. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.